Tomorrow, August 1st, a massive shift in American healthcare officially begins. We are looking at the absolute biggest transformation to the Medicaid program since the Affordable Care Act was passed. And interestingly enough, it's all starting right in the middle of the country. Tomorrow, exactly 200 people in Nebraska will become the very first Americans to lose their Medicaid health coverage under brand new federal work rules. Now, I know 200 sounds like a pretty remarkably small number, maybe just an isolated administrative action, but make no mistake, that number is actually the starting gun for a transformation that's about to sweep the entire country. Because zooming out to the big picture, those 200 Nebraskans are really just the tip of the iceberg. Ultimately, roughly 20 million people across the nation are going to be subject to these new requirements. We're talking about tens of millions of folks who will soon need to navigate a completely new administrative landscape just to maintain their basic health benefits. So to fully understand how this micro-level event connects to a massive macro-level shift, we're going to walk through this clearly and impartially step by step. We'll cover 1, the big picture shift, 2, Nebraska's early rollout, 3, behind the new policy, 4, both sides of the debate, 5, the real-world impact, and 6, the future of Medicaid. All right, let's jump right into Section 1, the big picture shift. So, where are these work requirements actually coming from? Well, they stem directly from President Trump's big budget law, which was signed last year. And under this legislation, a staggering 44 states are mandated to implement these sweeping new rules by January 1st of next year. That is an incredibly tight timeline for states to completely overhaul how they administer these vital benefits. It really sets the stage for a massive logistical challenge over the next few months, as local governments desperately race to meet that rigid federal deadline. Which brings us right to Section 2, Nebraska's early rollout. Why exactly is Nebraska jumping the gun and making headlines right now? In an exclusive interview with the nonprofit news organization Trade-Offs, Nebraska's Medicaid director Drew Goncharovsky gave us some crucial insight. He explained that the state intentionally decided to launch months ahead of that January deadline because he strongly believes these rules will push people toward greater economic stability. He genuinely views this as a chance to proactively help, saying it is an opportunity to build something that can reach out a hand to our membership. Why wait? But there are also major logistical reasons for their early start. Goncharovsky noted that Nebraska is uniquely positioned to launch early because it runs its own standalone eligibility system. Plus, it's a relatively small state. Only about 70,000 people are subject to the new rules there. When you contrast that 70,000 against the 20 million people nationwide, you can see why this smaller scale makes Nebraska the perfect testing ground. Their internal tech allows for a much more hands-on process. In fact, the state says it can automatically confirm compliance for about 3/4 of the people subject to the rules without even having to ask them for a single piece of additional information. Okay, moving into Section 3, behind the new policy. Let's look at the actual mechanics required here. To keep their benefits under these new rules, recipients have to complete 80 hours a month of qualifying activities. Basically, think of that like a 20-hour-a-week part-time job, but it's not strictly limited to traditional employment. Folks can fulfill this requirement by working, volunteering, attending school, or even participating in job training. But here is the critical third step: exemptions. People with disabilities, serious illnesses, parents of young children, caregivers, and a few other select groups are entirely exempt from these rules. And as you might imagine, figuring out exactly who falls into which bucket is the absolute core bureaucratic puzzle of this entire rollout. Now, because this is such a major shift in how the government handles healthcare, we absolutely need to look at Section 4, both sides of the debate impartially. The divide here is super sharp. On one hand, supporters firmly argue that the policy is a vital tool to lift people out of poverty and push them toward independence. And economically, they point out that this is projected to save the federal government $325 billion over 10 years. That's a lot of money. But on the flip side, critics point to research showing previous iterations of work requirement policies didn't actually lead to more people getting jobs. Instead, opponents argue these policies just bog people down in confusing paperwork, resulting in vulnerable individuals losing their life-saving coverage simply because they were completely unaware of the new rules. And that friction brings us straight to Section 5, the real-world impact. Specifically, the implementation issues happening on the ground right now. Preparing for this transition, Nebraska really went all out with outreach. They sent out tens of thousands of letters, texts, and emails. They ran radio and TV ads heavily. Yet despite that massive communication effort, early reports are showing real, tangible friction. Advocates on the ground like Amy Bank with the Health Center Association of Nebraska report that the notices left low-income folks deeply confused about whether the rules even applied to them. And to make matters worse, when journalists from Trade-Offs actively tested the state's official helplines, they experienced dropped calls and severe problems getting through to the Spanish language line. The irony is pretty stark. Massive outreach met with communication breakdowns exactly where people need it most. To be fair, the state acknowledges these hurdles and says they're meeting weekly with federal officials to improve these efforts. To truly understand the stakes of that friction, let's fast forward a bit to 2028. Recent national estimates for how many people could ultimately lose their health coverage under these new requirements are frankly all over the map. On the absolute low end, experts project 3 million people. On the high end, it is a staggering 8.6 million people. That means the gap between those two estimates is a massive 5.6 million Americans. That represents millions of lives hanging in the balance, entirely dependent on how smoothly they can navigate this new complex bureaucracy. And tying this directly back to our micro example, it's estimated that 30,000 of those people losing coverage by 2028 will be right here in Nebraska. Remember, only 70,000 Nebraskans are subject to these rules in the first place. That means 30,000 is nearly half of the entire affected population in the state, potentially losing their benefits. Which brings us to our final stop, Section 6, the future of Medicaid and how officials are monitoring all these changes moving forward. Director Golden-Schorowski admits that the number of people who appeal their coverage loss and ask for FAR hearings is what he calls his ultimate bellwether. He's heavily relying on that specific metric to ensure the state isn't accidentally cutting off people who actually have a qualifying disability or who do have earned income that the system just simply missed. He is very candid about this. He states it's the thing that keeps him up at night, calling it the one scary number. State officials definitely have high hopes for the upside here. They want to take this massive new stream of data about citizens' work habits and actually share it with the state labor department to proactively connect people with real job opportunities. But as 44 states gear up to follow Nebraska's lead by January, it leaves us with this final critical question. How do we balance utilizing this government data to truly help folks find jobs against the very real risk of vulnerable citizens losing their health care just because they slipped through bureaucratic cracks? It's a defining question for the future of American healthcare, and one we are all going to be watching closely as the new year approaches.